Dear student, good morning. After 1 month of breakups, today again we started our class. Last class I told you I have to discuss with lymphoma. I have to discuss with lymphoma. This is the 6th most important childhood malignancy. Remember this one. This is 6 types of most important malignancy in the childhood. Remember this one. Lymphoma is a malignancy of the lymph node. Remember this. Lymphoma is the malignancy of the lymph node. Remember this one. There are 2 types of the lymphoma. You look my presentation, you look my slide. There are 2 types of lymphoma. One is Hodgkin's lymphoma, another one is non-Hodgkin lymphoma. You look to the slides. Now what are the difference? What are the difference between the non-Hodgkin lymphoma and Hodgkin lymphoma? Hodgkin lymphoma is always, remember this, or it is bimodal or trimodal age group. That is 20 to 40 years one group, another group is 40 to 60 years like this. Next, non-Hodgkin lymphoma. Non-Hodgkin lymphoma is uncommon below 5 years of age, and non-Hodgkin lymphoma is more aggressive, more aggressive than Hodgkin lymphoma. Remember this one. Hodgkin lymphoma is 80 to 90% is cure rate, but non-Hodgkin lymphoma is a very much worse presentation, worse prognosis. Remember this one. Now, what are the sex? In Hodgkin lymphoma, male child is more common, but in non-Hodgkin lymphoma, both male female equally affected. Remember this one. Now, what are the types of the lymph node involvement? In Hodgkin lymphoma, always central axial group of lymph node is involvement. But in non-Hodgkin lymphoma is mostly abdominal, mesenteric, paired spaces, and peripheral lymph node is more effective in non-Hodgkin lymphoma. Remember this one. Next, what are the CNS manifestations? CNS bone marrow involvement is less common in Hodgkin lymphoma, but non-Hodgkin lymphoma, bone marrow and CNS involvement is more common. And it is advanced types. Non-Hodgkin lymphoma is always advanced. 50% already affected. That time is only the diagnosis. Remember this one. Now, how this is spread. The spread of Hodgkin lymphoma spread, contagious spread. You look to your books. It is contagious spread. Spread is contagious, but non-Hodgkin lymphoma is non-contagious spread. Remember this one. Now what are the mass? In Hodgkin lymphoma, mediastinal mass, that is chest. Mediastinal mass is more common, but in non-Hodgkin lymphoma is abdominal mass. Abdominal lump, abdominal obstruction is more common in non-Hodgkin lymphoma. Remember this one. Now the investigation, a lymph node biopsy. Lymph node biopsy, read Stenbar cell. Read Stenbar cell is pathognomonic feature of the Hodgkin lymphoma. Remember this. But in non-Hodgkin lymphoma, there is only inflammatory cell. There are no read Stenbar cell in non-Hodgkin lymphoma. Remember this one. Next time you have to go what are the clinical manifestation. Class we already told. Now today I like to discuss today about the non-Hodgkin lymphoma. Which one? Very aggressive. Very aggressive one is non-Hodgkin lymphoma. Remember this one. Non-Hodgkin lymphoma is more aggressive than Hodgkin lymphoma. Remember this one. Today I like to discuss about the non-Hodgkin lymphoma. Remember this. Non-Hodgkin lymphoma, first of all it is types. It is third. Non-Hodgkin lymphoma is more aggressive. It is the third most common childhood malignancy. Remember this one. And what the classify? How classify non-Hodgkin lymphoma? First First all you should, it is, first all, it is classified as, first all there are four types. It is four types. Lymphocyte rich, number one, lymphocyte rich, non-Hodgkin lymphoma. Lymphomas list, non-Hodgkin lymphoma. A little bit. Hodgkin lymphoma classified again. Once again, I told. First all, it is bucket lymphoma. Bucket lymphoma is about 40%. Bucket lymphoma is 40%. But diffuse large cell lymphoma is 20%. Then lymphoblastic lymphoma, this is also 20%. Then anaplastic large cell lymphoma is rest 20%. Remember this. This is the classification on the non-Hodgkin lymphoma. Remember this. Now, what are the clinical manifestation? Clinical manifestation, first of this abdominal manifestation. What happened in the abdomen? There is abdominal lump, abdominal obstruction, intestinal obstruction, ascites. Ascites and hepatosplenomegaly is most common in non-Hodgkin lymphoma. Then head neck manifestation. Head neck manifestation. What are the head neck manifestation? That's a jaw mass. There is a jaw mass, jaw swelling, phoptosis, illness, tonsil and nasopharyngeal tonsil, and also lymphadenopathy. This is the another type is anaplastic large cell lymphoma. It is manifested as peripheral lymphadenopathy, and cutaneous manifestation, and central and bone marrow involvement is most common in anaplastic large cell lymphoma. Remember this one. Now what is the investigation? What is the investigation? Investigation is complete blood count with peripheral blood fill. Number one. Number two, that is biopsy of the lymph nodes. Biopsy of the lymph nodes, very much important. But in case of Hodgkin lymphoma, there is a Reed-Steinberg cell. But in non-Hodgkin lymphoma, there is only an inflammatory cell. There is a lymphocyte, monocyte, then neutrophil. All the inflammatory cell is present there. Next, you go for body fluid analysis. Yes, body fluid analysis. That is pericardial fluid, ascitic fluid, CSF will be analysis. Number three, you should go for imaging. Imaging, that is X-ray chest. Number one, X-ray chest. Then CT scan of the abdomen, chest and head neck. The CT scanning. Next, you go for ultrasonography of the abdomen, and there is a echocardiography. Echocardiography should see if there is any abnormality in the heart. Next, you go for some biochemical examination lab, liver function test and renal function test should be done. Now, what are the clinical? What are the management? Management. Already I told you. Management. There are two types of management. One is a supportive management, another is a specific management. Supportive management means first of all there is a neutropenic diet. Then correction of the dehydration, correction of the anemia, correction of the coagulopathy, correction of the tumor lysis syndrome. So all corrections should be done. And there is the antifungal drop in the mouth and acroflavin, hip bath should be given. Now what are the specific treatment? Specific treatment is protocol-based multi-agent chemotherapy. Protocol-based multi-agent chemotherapy you should go. Now what are the protocol you should use? It depends upon the types of the cell. The protocol is different upon the types of the cell. Which cell type? If it is BLL, BLCL, then the protocol should be LMB 96 protocol. LMB 96 protocol. Remember this one. Now LMB 96 protocol again is subdivided by three stages. First one is cough. COP, cough. C means cyclophosphamide. O means oncomine. That is vincristine. P means prednisolone. Remember this one. This cough. This for 1 week. Next week given Copharum 1. Copharum 1 means, copharum means, C means cyclophosphamide, O means oncovin, that is vincristine, P means prednisolone, adriamycin means doxorubicin, remember this one. This is a copharum 1. Then copharum 2. Copharum 2 also like this. C means cyclophosphamide, O means oncovin means vincristine, P means prednisolone, and adriamycin means there is a adriamycin means doxorubicin. Remember this. The total duration of the treatment is 3 to 9 months. Right. Total duration of the treatment is 3 to 9 months, and prognosis is very poor in this regards. Remember this one. Now you should remember this, that what are the oncological emergency. You should know what are the oncological emergency. Number 1, tumor lysis syndrome, Suburin-Mediastinal syndrome, then Suburin-Benagoval syndrome, then neurological emergency, then you show there is a corneal nerve palsy. These are all the oncological emergency. Remember this. Thank you very much. Thank you very much for patient hearing.